So this is another episode of Hair Impact Podcast. We are here with a special guest this time. His name is Oluf, and he's an oncologist doctor doing research also. But I want to give the floor to him so he can introduce fully his names and his occupation. Oluf, welcome.
Thank you very much.
Thank you for being here. Can you tell us specifically your expertise, please?
Yeah, thank you for inviting me to talk about this. I am a clinical oncologist, and I have worked with patients for more than 25 years. And I also do research. I am actually now doing research in two universities, the NTNU, which is the Norwegian University of Science and Technology in Trondheim, and at the Aalborg University Hospital in Denmark. And also I'm a clinician at a quite small oncology clinic called in a hospital named Levanger, Sykehus Levanger. So I have a 50-50 position of clinic and research. And my name is Oluf Dimitri Roe. I have to say my full name because it's a mixture of a Norwegian and Greek. So we could have done this interview in Greek as well, but let's do it in English today.
Yeah, that's why I didn't tell your name. You are better to tell it yourself. It's a bit difficult for me. So you are in Norway, let's say, a doctor and a researcher, also having a position in Denmark. So you are dealing with lung diseases, let's say, right? Is that what you are focusing on, your research or your clinic?
My research is mainly on thoracic cancers like mesothelioma and lung cancer. But in my clinic, I work with many types of cancer.
And these diseases, you find out where they came from, what the source of people getting sick. Is it that your research focusing?
Okay, so there are two main parts of my research. The one is the epidemiological part to connect asbestos to lung cancer and mesothelioma and environmental asbestos exposure, which has been an interest the last years. And the other part of the research is to find biomarkers in the blood so that we can find the cancer much earlier so that you can get cured without chemotherapy and other therapies. So these two parts are the main research focus since 2004.
Regarding asbestos, you said, is only in Norway your research or in other parts of the world regarding asbestos?
Well, asbestos has been used all over the world for many decades, but it was stopped in most Europe in the 80s and 90s. But because the use of asbestos makes disease many years later, maybe 50, 60 years later, you get the cancer. So it's very important to try to find new ways to detect it and to prevent it and treat it. But I have mostly worked with asbestos disease now in Denmark because in Aalborg there was a big factory of Eternit or Elenit, as we say in Greece, and now the highest incidence of asbestos cancer is in that city. In Denmark, so and probably one of the highest in the world at the moment. So we are all the places in the world that had such an industry, they have been affected from that, and it has been too little research on the impact of the environment and how people can get sick of it, and how we can take care of it in a good way. So yes, I think it's a very actually important research field today, because not only takes so many years to get the cancer, but because many places in the world still use asbestos very much, including Russia, China, India, Brazil, and so on. So it will become a bigger and bigger problem with the years to come. So yes, it's a very international topic. It's not only Norway.
Yeah, right. But even in countries that they banned it, you can still find asbestos in some of the product. You just don't know it. For instance, I just read an article about in America that is banned asbestos, but they found in powder, talc powder.
Yes.
So your job is very important, because even the products we use, we don't know if asbestos is in it.
Yes, it's true, and all the people that work with the construction and the rehabilitation of old houses, and plumbing and electricians, they go into houses that were built in the 60s, 70s, 80s, 90s even, which has a lot of asbestos products, and they can get sick from their work. Mm-hmm. So yes, it is. The knowledge is a little bit low about asbestos in these days. We need to refresh the knowledge and to make the awareness more high on this.
So this podcast is very important there, because now you're giving awareness to people to protect themselves.
Yes, I hope so, and I hope a lot of people will listen to your podcast, and I hope that we can all do some important things for people's health in the future.
Okay, a final question about the biomarkers you're researching. So in the nearby future, I guess, that you will learn from the early starts that you're going to get a cancer, right? Just to not to go through the chemo and just prevent the whole disease with these biomarkers. And is also technology is going to use that, going to be used for you to know, like, I don't know if it's true, but they say that there will be a microchip in us and giving information about health markers like the ones that you are mentioning. Yeah.
Well, I don't know about the microchip, but I think that we are going towards more and more blood tests or biological tests for knowing about our health and about if we are in the process of having a disease, for early detection, not only cancer but other diseases as well as diabetes and so on. But I think that the technology of the health technology and the molecular technology, that is the most important thing that has happened the last decades, and has decoded many of the secrets of biology that we actually have been thinking of for many years, which has, for example, gave us immunotherapy, which is one of the most important discoveries of the last 50 years in cancer treatment. So without technology, molecular technology, this could not be discovered. And so now we can actually test. We have tested thousands of compounds in 100 microliter of serum from persons here in our project, and we found very interesting things about predicting cancer. So we haven't published these things yet, but we are well on our road to actually write about it and validate the results, which is very important, of course. And we hope that maybe we can have a biomarker for lung cancer or mesothelioma in the near future. So we will cross fingers, and we hope hope a lot of people will do research on this and have some good results.
Okay, thank you so much for being here today.
Very much.
I'm hoping the best for your projects, and we hope to, with this, saving thousands of lives, including asbestos and the biomarkers projects. Thank you so much for being here. Good luck.
Very much. Thank you.
And this is the end of this episode.